I'm taking my video on my computer because my phone doesn't have enough storage. Hashtag I like taking pictures. Okay. Um, I'm starting off with hand hygiene. Hi, my name is Francesca. I'm a Wauwani University nursing student. What's your name and date of birth?
Ashlyn Melvin, 11/28/1999.
Perfect. Thank you for putting on the gown that I gave you. Have you used the restroom?
I did.
Perfect. So we're going to be doing an abdominal assessment today. All right, I'm going to move you to a working height for me, and then I'm going to have you sit in a supine position. So if you'd like to come to the edge of the bed and there you go. All right, I'm going to pull this down to your belly button so that I can do your chest assessment. I am looking for symmetry and diameter and then respiratory effort. So you are symmetric here. There's a little bit of asymmetry right here. Good. And then can I have you raise your arms above your head? So I'm looking at the ratio from the side of her chest to the front of her chest, and it's about double here, which is good and normal. And then I'll have you put your hands down now. And then I'll have you take a few deep breaths for me. Her respiratory effort seems unlabored and good. All right, I'm going to palpate her chest for tenderness and masses and any crepitus. Let me know if anything hurts, okay?
I'm good.
Alrighty, there's none, so it's normal findings. I'm going to palpate chest excursion. So I'll have you take a deep breath in for me. Good, perfect. And then I'm gonna have you turn around so I could do your back so that the camera can see. Okay, you don't have to twist. I'm putting my hands about her 10th intercostal space. So I'm gonna have you breathe in. Looking for expansion from my thumbs away from each other. That looks normal. You can go ahead and sit in front. I'm now going to palpate for tactile firmitas. Okay. And in this, I am listening for the vibrations from the lungs on her chest and on her back. So I'll have you say 99.
99. 99. 99.
And then I'll have you turn around. And if you can, give yourself a hug for me like this. And that is so that I can hear the vibrations from her lungs better on her back. Go ahead.
99.
Good.
99. 99.
Perfect. Okay, I'll have you sit normally now. Okay. Next I'm going to percuss the anterior and posterior lung fields from top to bottom. Alrighty. And then I'll have you flip around. I'll do the same posteriorly. Okay, perfect. Now we're going to do the cardiovascular assessment, so I'll have you lay down for me. First, we're going to inspect for PMI or any contours in her chest. And I'm looking, I don't have a light, but I can see that there's nothing visibly abnormal. I'm going to now auscultate the heart with the bell and the diaphragm. And I'm going to first start at the second intercostal space on the right, which is her aortic. And then her second intercostal space on the right, which is the pulmonic. And then next I will be auscultating a third left intercostal space, which is second pulmonic or Erb's point. Next, I will be listening at the fourth left intercostal space, or the tricuspid, and then I will be at the fifth left intercostal space, which is the mitral. Okay, all of those sound good, and that concludes the cardiovascular assessment. Next, we're going to do the abdominal assessment, so you can go ahead and put that back on. I'm going to position her in a flat position as she already is, and then I'm going to have you bend your knees a little bit, and then I'm going to drape her. Okay, perfect. So first I'm going to inspect and then auscultate, and then percuss, and then palpate. So I'm going to look for symmetry, all of which looks good. Could you put your hands behind your head and then do almost like a sit-up? Yep. Okay, perfect. There is no protrusions. Symmetry is good. Her color is good and her stomach is flat. Now I'm going to auscultate for bowel sounds in all four quadrants. So I'm going to start with the right upper quadrant. And now in her left upper quadrant. Now I'm in her left lower quadrant. Bowel sounds are noted in the left upper quadrant and epigastric area. Alrighty, now I'm going to auscultate with the bell of my stethoscope over the aortic, renal, iliac, and femoral arteries. Okie dokie. I'm going to start with the aortic. And then her renal. Now her iliac. And femoral. Okay, I did not hear any abnormal sounds. Next, I'm going to percuss in the quadrants, starting with the right upper quadrant. Okay, next I'm going to palpate superficially and then deeply in her abdomen. Let me know if any of this is tender. Now I will be doing deeply. Oh. No distension or tenderness. Next, I'm going to percuss the costovertebral angle and assess for tenderness. Let me know if any of that is tender.
No.
Nope. Okay, perfect. And then lastly, I'm going to palpate the abdominal aorta. Make sure you don't have a triple A. Alrighty, that is all for our assessment today. You can lay your feet down. I'm going to return her to a normal position. And then I'm going to perform hand hygiene. And I will get out of your hair, ma'am.